Welcome to the Physical Therapy San Pedro podcast. This is episode 53, and today we are discussing rib sprains, causes, symptoms, and effective recovery strategies. I am your host, Dr. Janae Brown, and I am joined by my amazing physical therapy team. To my left is
Dr. Silverton Wynn.
And to my right,
Dr. Bay.
Okay, guys. So we're sports physical therapists. We have this podcast here, and we try to break down for you guys some cool diagnoses each quarter, go through the body and describe things that we feel like you guys might be interested in as our listeners and subscribers. So we're in our thoracic spine series, and Dr. Bay wrote this amazing blog for us about rib sprains. So Dr. Bay, talk to us about why you wrote this blog. Why rib sprains are important to you.
Well, I feel like this is one that sometimes needs treatment and sometimes doesn't. And I do feel like I've seen cases that really benefited from treatment. So I just wanted to educate the public. And also, this was myself. I had a rib sprain that I didn't know that I need treated. And I did see like symptoms persist over time. So I just wanted to see if we could educate people and see if we could get them to seek treatment more quickly.
Yeah. And when we talk about the thoracic spine, oftentimes the rib cage is something that people don't often think about. The general public doesn't think about as being sort of a problem in the middle of the body. But because the rib cage attaches to the thoracic spine, we see this commonly, this rib sprain commonly, or rib issues commonly. So this is the one we see probably the most common, right? So I'm excited to dive into this. Dr. Silverton our teacher is going to talk us through anatomy today, and he's going to give us some understanding of the rib cage and its function and why it's really important in detail. So Dr. Silverton, take it away. It's all yours.
So the rib cage is basically from here to here, makes up most of our chest, our thorax right here. We got 12 ribs going from top to bottom. All the ribs have attachments on the spine, on the backside, and they'll wrap around the front side. Most will attach to the sternum, our breastplate on the front end here. Ribs 1 through 7 will attach from the spine directly through their own cartilages to the sternum. 8 through 10 will converge through and share a common cartilage as they attach to the sternum. And floating ribs 11 and 12 just stick out from the backside, wrap around maybe a little bit, and then that's about it. They don't fully attach around the front side. They have 3 major functions. First off is breathing. It protects our vital organs, particularly our lungs and our heart, so that as we breathe, upper extremity motion, as we move our arms, and core and spine stability. So that way it gives our arms, our legs something to move off of.
That's cool. Anything specific we need to know about breathing or upper extremity movement or core and spine stability, why those things are important? Anything else you want to add? Or Dr. Bay, you want to add anything? Either one of you guys?
Breathing's good for life.
But did you even breathe?
So good.
I would doctor it. As far as breathing, if you want to break down the anatomy on that one, we mainly have the diaphragm for dropping our lung space down, or our thoracic cage down, thoracic space down, kind of like if you're pulled down on a plunger to pull air in through our mouth or nose. And then we have the accessory muscles, our pectorals, and pretty much anything else that attaches from the spine to the rib cage that helps with elevating the ribs to make more space and take that deeper breath. For as far as upper extremity motion, our arms only have one real bony joint connection to our thorax, our main rib cage area, and that's through our sternoclavicular joint. So from the collarbones, the shoulder blades, and the arms, that's only real major ligamentous attachment. Everything else is through muscles. And then as far as core and spine stability, all their back muscles and have to attach to something. So a good majority of those are going to be attached to ribs as well as to the spine, and it gives our arms and legs something to push on as we move through space and through our environments.
Yeah, it's good stuff. D-Bay, anything to add?
No, he covered it. Just it's very instrumental in full body motion.
Okay. I'm going to cover common causes of rib sprains, and I'm going to cover symptoms of rib sprains. So let's start with the common causes of rib sprains. 4 common causes we see are trauma, repetitive movements and overuse, sudden movements, and coughing or sneezing. So trauma, that's just a direct impact, a fall, an accident, something that you do in a sport, something you can't control. And that's common in life, right? Especially if you're an athlete or you are involved in any sort of recreational sports, you're going to be at risk for some sort of traumatic event, something we can't control, but something that happens. Repetitive movements and overuse. So repeated bending, twisting, or lifting with poor posture. These are things we can control. So these are our controllables, and we try to help you guys with those controllables by doing things properly, effectively, safely, not overdoing it, not underdoing it. Those are the things that we're going to try to help you with. Sudden movements, a sudden twist or turn, a sudden lift improperly. This happens often. We go to pick up something that we have not picked up in a long time, like during Christmas, when we're rotating and putting stuff overhead and on one leg on the ladder, and we reach up and we kind of turn, and too much force in one area. These are the things that can happen, and a rib sprain can happen from something like that. And then, funny enough, coughing and sneezing, getting sick. I've actually had a few people, maybe 3 or 4 in the last few weeks, that I know have a rib sprain because everybody's getting sick right now. And so when you cough or you sneeze, or just that forceful force, in the rib cage area, because it's so instrumental in, our breathing and the forces that come through our spine when we cough and sneeze, that can create a problem. So you can get a rib sprain from that, an irritation in the rib cage area, or in, a rib strain in sort of the intercostal area as well. So those are our common causes. Symptoms. How do you know you have a rib sprain? Okay, so you might be thinking, this sounds like I could have got one. I'm gonna give you some reasons or things or some symptoms of why you might go, this is something I might have. So symptoms of a rib sprain: pain and tenderness, swelling and bruising, limited mobility in the rib cage, and muscle spasms. So those are 4 common symptoms of a rib sprain. Pain and tenderness, just, you're just touching around your rib cage and it's tender and it's sore, more sore than normal, usually in one area or on one side. That might be an indication. Swelling and bruising. You got a big bruise right around an area on your rib, or it's a little swollen in that area. That's an indication. Limited mobility. You can't move. You can't rotate as much to the right as you used to be able to rotate, but left is fine. That might be an indication. Or just going to reach up into a cabinet, you kind of extend your thorax a little bit and you feel sort of restriction on one side. That might be an indication that you have a rib sprain. And then muscle spasms. So, you just feel like contracting in that area. It's tight, sore. You just feel a tightness or a just really sharp discomfort in the area of your rib cage. That could be a muscle spasm, and that could be an indication that you have a rib sprain. So that's my part. I'm done. I'm going to move on. I've been talking. And Dr. Bay is going to take us through. And do you guys have anything to add before Dr. Bay takes us through? Anything else that causes symptoms, things that you guys maybe have seen with some of your patients that maybe aren't on this list? Like oftentimes we have this sort of constructed good, like it should look like this, but then maybe we had a patient that it didn't look like this, and this is what was going on. Anything you guys want to share?
No, I've just had a couple patients like with blunt impact, like from fall, or like a hockey player that was like shoved into the wall. So like these things are pretty classic in what I saw in them.
Okay. Yeah. Anything with you? No?
I don't think I've had anything too crazy as far as ribs or anything like that. More so just differentiating whether we're talking about sprains or bone bruises or fractures. Just making sure we can roll out more serious sort of things. That's like, okay, it's okay for us to work on that and rehab as well.
And sometimes it's a combination, right? We could have like a fracture and some spasming in the intercostals, which is like maybe it's more of a strain issue or a muscle issue, and we need to work on sort of some of the soft tissue between the ribs. Sometimes it's hard to know which it is, because we know that there's a limited mobility in this one level of the rib or a couple levels of the ribs, right? But there's also some muscle tightness and as well. So sometimes it's combined, but we tend to call it a rib sprain, right? I don't see too much like rib strain going around because it's a bone, right? So it's a bone to bone attachment, or bone to ligament to bone attachment.
Yeah. And I think the other thing is, since the ribs are so interconnected with the body, most people that have a rib sprain that I see also have either dysfunction in their shoulder or their neck at the same time from the accident.
Yeah. Yeah. Okay. Let's take it into some treatment. When, Dr. Bay, should our listeners, watchers, or readers go seek medical attention? And if they do seek medical attention, what does treatment look like? What does recovery look like for them?
Definitely. So, as I mentioned when we first opened up the podcast, the rib sprain is something that can heal on its own. But after several weeks, if your symptoms are persisting or worsening, even, you might want to seek medical attention, even with these 3 specific points, which is that your pain has not improved, that you are coughing up mucus that would be colored, and then also that you have fever or chills. Those would be potentially signs of infection or signs that maybe it's an undiagnosed fracture and it would be time to go seek medical attention. Once they've cleared out those 2 big options, physical therapy would be where you would end up, and that's us. So the main things that we're going to discuss for treatment are pain control, activity modification, supportive modalities, breathing exercises, core and spine stabilization, manual therapy, and progressive loading. So let's break these things down. When your rib is initially sprained in the acute phase, as we call it, those first couple weeks right after injury, things are very painful. So controlling our pain with things like medication, ice, heat, or a warm Epsom salt bath can be really important to help get the pain levels down. As our pain levels come down, our body can start to heal more and we feel more freedom to move. So that's very important. The next is activity modification. It's important that this acute period you avoid aggravating activities. So that means if you need to sleep in a different position, potentially with a little bit of elevation so that you're more comfortable at night, that's important because sleep is your time to heal. You're going to not avoid movement altogether, but you will try to avoid your sport or your work, whatever movements, maybe if it involves a lot of arm movement, a lot of twisting, you're going to calm those activities down and back off so that your body can have a chance to heal. The next is supportive modalities. You may have encountered people that said they got like a wrap or some tape around their rib cage to kind of give it like a gentle hug to the area. That can be pretty helpful in the early stages as well. The next thing is it's very important to maintain proper breathing. Dr. Silverton discussed how our ribs move when our diaphragm helps us inhale and exhale. The ribs kind of follow along. We do not want to avoid movement in our rib cage when we breathe. That will create patterns that will lead to dysfunction for our daily life or sport or work down the line. So we want to work on exercises that your physical therapist can instruct you in that would help your rib cage to restore its normal breathing pattern, and then work that into movement as well, whether it be how do you breathe when you push a door open, or how do you breathe when you pull something heavy, how do you breathe when you lift. Those are all important things that we would help you re-educate. The next is core and spine stabilization. A lot of core muscles attach onto the rib cage. So retraining those stability patterns with full body movement is very important for when we return to big motion. Manual therapy can be very helpful. So as Dr. Brown discussed, there's spasms in the muscles. We can use soft tissue techniques or different tools to help combat those spasms. There's typically a loss of motion, so joint mobilization and neuromuscular re-education techniques, kind of PNF type things, can be very helpful to help restore full motion of the tissues and the joints that assist with rib cage motion. The last would be progressive loading. So this is what we do really well with physical therapy. We kind of take you where your symptoms are at, and then we say, okay, this is what is working for your body right now. And then we'll slowly add volume or load or progress into a bigger range. And then we're going to slowly work you safely back to all of your goals, your sport, your work, your daily life, whatever those goals may be, so that you've now achieved without symptoms once again since your injury.
Good stuff. So much good stuff. Okay. So first point I pulled away from what you said that I thought we should touch on this, but you might end up at your PT first. And I would say, like, we talked about seeking medical attention, but really this is sort of one of those really tricky sort of injuries, and people don't often know that it's going on. So not a lot of people have them. They're like a infrequent thing, I would say. And they look suspicious. They're not classic. So you might not go to a friend and be like, with your shoulder, if you like hurt your shoulder and your shoulder's having certain symptoms, one of your friends might be like, you might want to go get your rotator cuff checked out or something. People might have a better understanding of it, but with a rib sprain, it's a little bit different. So I'd say that if you have any pain in your in your rib cage, in your back, in your mid area, you can, mid back of your area, or upper back, neck, shoulder, you just can go straight to a PT. And you can do that right away. If there are other things here that Dr. Bay mentioned, like the coughing and mucus, fever, chills, we're doctors, we're going to direct you to the right proper channels. So if we see something suspicious, we would do that as well. If you are listening to this and you had that symptom first, go there first. It's probably not a rib sprain. It's probably something else. But a lot of times you get sick, really, really sick, and this comes after your sickness as well, as we discussed before. And then the other point I wanted to make was about breathing. And I think our practice has evolved a lot where we try to help people breathe a little better. And we've changed and really focused on breathing with patients. So I feel like simple just teaching people how to breathe properly, take your time breathing, and not fully expanding your rib cage too much, but slowly breathing and teaching you where to breathe from. That's something that I feel like we spend a little more time on in rehab than we have in the past, because we find that people breathe incorrectly or breathe from the wrong spots. And Dr. Silverton talked a little bit about the diaphragm earlier, but we try to teach people how to breathe properly, because sometimes just simple, like stopping someone and working on their breathing that one thing can just be so helpful with this particular diagnosis. And I want to touch back on too, and I don't know if you guys have had this, but I remember having a really tricky, a patient that came to me, and I think they were in they've sought a lot of medical care before getting to me. And I mean, they thought it was their gallbladder. They were looking at all their organs, and it was, this particular thing can feel like really sharp, deep pain, and can feel like it's maybe something different than a rib sprain. So I would just say that it never hurts to go see a PT first. If you have anything going on in your musculoskeletal system, any pain physically in your body, we're typically the ones that are going to know how to fix it faster than anybody else. So don't wait on that. Even if it's not that, we will refer you out as well to where it goes. But I'd hate for you to let it linger and go months and months and months and not get some help, because once we get you in here, it's a pretty easy thing to fix with a little bit of time and some treatment. Yeah. So just wanted to share that. That's one of my personal experiences. I had someone that, she got to me and it was 3 sessions we were done, but it's been 6 to 9 months that she'd been dealing with something like this. So yeah. Any thoughts? Have you guys had any quirky cases? I know you talked about your hockey player. Anything you guys want to share on your experience with rib sprain or rib injuries?
Well, yeah, I was personally interested. I mentioned that I had one, and it was really early in my PT career. It was when I was doing partner work for the first time in dance, and I was in this position where I was bent all the way to the side, and it popped. And it was tender, but it didn't really limit me too much. It just kind of calmed down. Then I did feel after a while, because I hadn't done PT for it, when I would do things on my right leg, I would be a little bit more unstable, bending. So I just, looking back, I had wished I had dealt with it to properly retrain my muscles again, because I felt like it limited my progression in dance after that.
Yeah. Because if the pain kind of goes away, you just kind of avoid.
My pain wasn't there, but I was I'm really can't control my motion as well as I should be able to.
Yeah.
So that's what's one of the takeaways is I always wish people would get checked from us, even if they think it's not a big deal.
Yep. Any thoughts from you?
No, just the ribs can be, and anything in the thoracic region can be rife with issues, just because you can get a lot of pain with some pretty serious areas. So just make sure you get yourself to some sort of medical professional that can do the differential on it and make sure that if it looks like a rib, sounds like a rib, and treats like a rib, then it actually is one, as opposed to shingles or something that's coming from the heart or lungs or any of the other vital organs in that area. So, but most PTs are well trained on doing that differential these days, and then it comes down to treating it just like a sprain, like most other joints.
Yeah. I think the big key with this one is movement. I think where, if it's an organ issue, moving won't change it, right? If it's your gallbladder or your kidney or anything internal, you can't reproduce that with movement. Anything that is musculoskeletal and something that we treat, you can. So if you're going to rotate and it hurts, that's not a internal organ thing. That is a musculoskeletal issue, and you need to see us. So that is if you were to take away one thing when you move, if you move your body and you go down to do something and you feel pain, it's probably most likely something that we could help you with. I don't know if you guys can think of anything off the top of your head. I know you're over there thinking as the teacher over there, if there's anything that would create if a person moves and it would be something different. Are you thinking of anything in your brain?
If a person moves and they get the symptoms also.
But it's not anything musculoskeletal?
Pericardial effusion shows up as that. I think it's
heart.
Whatever sign that is, where they lean forward and they get this, they feel better with that and they go upright. I can't exactly remember the order on that one, but there are some things where like movement will bring on the symptoms and not moving will ease it. Yeah. So there are little caveats to that, but as a general rule for musculoskeletal sort of things that PTs fall under, if you move and it hurts and then you don't move and it doesn't hurt as much, that's generally a good place to start with a few caveats here and there too.
Yeah. We would be able to figure out with our test and retest process. We'd be like, okay, this person is not responding to treatment. Yeah. We're going to refer them out. Yeah, we're going to get asked for some more testing to be done. Yeah, for sure.
But this is one where it doesn't feel good. And if you move and it hurts, then we want to help you. So get some help right away. Do you guys have any other thoughts on rib sprains, rib cage area? Anything else you guys want to share before we wrap? No? Pretty good. Okay. Well, thank you all for tuning in to this 53rd episode. We have 52 more episodes that you guys can go listen, read, watch on our YouTube page, on our podcast, which is on Apple, Amazon, Spotify, anywhere where you listen. You can go read it on our website at Physical Therapy San Pedro. But we are just trying to give you guys good content and things that we think that you guys could learn from, share our knowledge base, and help you guys just understand physical therapy a little bit more. So that's all for you. In our clinic, we're doing some big things. We're in a new location. So we moved to a storefront on 6th Street here. So we are doing our ribbon cutting on the first week of March 6th, which is a Thursday evening on our first Thursdays here. So if you are in San Pedro or the LA area and you want to come celebrate with us, come do that. That's going to be at 6 p.m. here at our center. We just put out our knee online pain program. So if you have knee pain and you're not around us and you want to get some help on your own and you're in some other area of the world and you want to just get a program that can help you, check that out. We're doing this month of freebie because we love you guys. We're giving you the ankle pain program as well. So you get the ankle pain program and the knee pain program if you purchase that. So check that out. What else are we doing? We're Dr. Silverton's going to be leading us in some lift clinics with Coach Zoe. So that's going to start soon. So we have a 6-session series of lift clinics. So deadlift, squat, overhead press, cleans. We're doing some mobility stuff in there. So if you want to improve your lifting technique and you want some help with some warm-ups, activation, things that are going to help you with your lifts, look out for that. We'll be sharing that on the next few weeks, and you can look out for that. You can come to one session or you can come to all 6 sessions. And what else are we doing? Anything else you guys want to share? No? Okay. Thoughts? Okay. Follow us on Facebook, Instagram. You can come check out our website and check out things that we're doing in the center. But we thank you guys for tuning in and following along with us. And we wish you guys a wonderful rest of your day. Bye.